Good. So I believe we
There
are
you go.
recorded.
You got it. You're on.
You got it? Okay,
Yeah.
fantastic. Um, good. So let me try to get back to the gallery. And I might just turn off my video. I don't want to give you guys kind of the, uh, you know, shaking head screen on a Sunday morning. So let me, I'm just going to stop my video. That'll also give me the ability to share a screen a little bit more easily. Gotcha. Good, good. So I just want to welcome folks this morning. Yeah, there's quite a few here. So it's kind of our usual agenda, kind of just some quick updates, and then I'd like to talk about hear about kind of issues with wearing, and any questions you might have, and then kind of dip into the latest science paper that I'm super excited about. So I'm just for as far as updates go, I'm just on my way back from Houston, and the intent of the trip was to meet with neurologists at University of Texas Health Science Center in Houston to set up clinical trials. And so that, for at least as an initial visit, we've been Zooming for a few months with these folks, but they had never they didn't have gloves in their hands, right? So I was able to bring gloves and to talk to the senior folks and their postdoc. And it looks like, I mean, we've got, not looks like it, we have got a solid protocol written for clinical trials. That these neurologists are super thorough. I'm very anxious to get results, but they're seeing like a 2 year phase 1 study before going into something on phase 2. And phase 1, we would just be testing similar things to what you guys are already testing. Do we need one glove or two? Can we do 2 hours a day or 4 hours a day? Right. So you guys have given me anecdotal information at answering those questions, but which has been super helpful kind of for me recruiting neurologists, but they work with, kind of a different level of kind of data analysis and assessment tools. And so that will get officialized. We've also written a small proposal to do joint work with an electrophysiologist at the University of Houston, who would be, every 3 to 6 weeks, would be putting our glove patients under electroencephalograms to be able to really try to go after a mechanism, what can be seen in the brain as people are wearing the glove. With the glove on, but also cumulatively, right, with the glove off. Are we really, really changing the Parkinsonian circuits, or is it some epiphenomenon? So I'm really, really excited. I was also these neurologists are in the sphere of a neurosurgeon who's a longtime colleague, and he's the one doing deep brain stimulation. And so he's eager to be able to, while he has an electrode down the brain, he's eager to see what he can see from the glove.
Very strange. It's good, but it's strange. A lot of the same stuff is cancer.
Yeah, well,
nothing's changed in so many years.
Not sure who's
audio we're getting. Sure, so it's gonna be a lot of similar stuff. I mean,
it's such a small screen.
Nothing's changed. Yeah, I could almost do the whole thing. I could almost say the whole thing, but I didn't.
This is Thomas's iPad. So Thomas, I can't quite get my hand on.
But they have women
mute button.
pastors there, right?
Woman,
Thomas,
yeah, there's a woman mother and an acolyte is up there. And full-grown woman, acolyte.
Yeah, I don't get it faced.
So it might be St. John the 23rd.
Steve, can you mute Thomas's
5,000 people
iPad?
going up for mass.
Yeah,
Although it did have mass.
I'm trying through the phone. I can't quite see.
Oh, okay.
They're still the need to run out.
I think I got it. Yeah. Okay. Let me get back to our gallery.
Steve, this is really exciting news that you're sharing.
Well,
I really feel a lot, a gust of forward movement here.
Beautiful. Thank you. Yeah. And I think these folks are also excited about the app, about having basically the data collections it'll make a lot easier, but it's just I needed the professionals, right, to make this transition also
Right.
into something, all this can then lead to greater confidence in other neurologists kind of adopting or experimenting with these technologies. So
I was in a support group a couple of weeks ago, and they had a neurologist, a leading neurologist from the Phoenix area there, talking, and she's taken a job representing one of the pharmaceutical companies with a different technology solution that they're offering. And I mentioned about the gloves in the setting, and I was interested in what she would say. And she turned to me, sort of had a flippant attitude, and said, "Well, that is technology from the turn of the 19th century. You know, we're talking
yeah,
here about modern technologies." And I thought, honey, you're missing the boat because there's
yeah,
things that
that's
we don't know about older, about this vibrating technology. So anyway, I
yeah,
thought I was way ahead of her on the curve
that's
uh, in
yeah,
terms of
yeah.
considering alternatives.
That is frustrating. I mean, it's just yeah, it's good. It's good for people to be skeptical and kind of resistant to just the newest thing, but also to claim. So it is true that vibration was noticed to have to have positive effects on tremor and things like that. And it was not able to replicate it because they were like building like vibrating chairs for folks doing kind of whole body things and not targeted. And it seems that the more we learn about the brain, as we'll see today, I mean, um, we don't we're finding new targets, right? And it's not just like where in the brain, but it's also kind of at the right frequency, at the right amplitude. Even Toss's early gloves, the amplitudes were too strong, and somehow those signals, were kind of conflicting, overwhelming, and not really sure what the answer is. But as he dialed back the stimulus amplitude, all of a sudden we got the effects that we see in his small study. So again, I don't want to be overly defensive, but it's just you can't just throw out, vibration therapy, um, especially given the fact that it has like almost no side effects, or maybe the only side effect is you need fewer drugs. So um,
Right.
yeah, yeah. So that's interesting. It also seems that Toss has just made lots of enemies in the neurology field by kind of going kind of too strong too early with his claims. And
Hmm.
so he's created some skeptics that we have to overcome. I didn't get
Right.
that. I didn't get that at all from the neurologist I'm working with at University of Texas, right? And she's had the movement disorder clinic there. And being in a big city, they have access to just many patients. So yeah, so I will in the coming weeks, maybe even by the next meeting, I can post the protocol on our website to kind of give people kind of a more robust idea about what we're going after.
Also, Steve, these gloves are not the only game in town. I
Yeah,
think
yeah,
a couple weeks ago I mentioned there's the Beach Band, which I'm going to purchase one, but I don't know if it's coming from England and I'm going to be traveling in a week, so I don't want to order it and have it come to where I'm
yeah.
not. There's also Nick
What is
Ortner's
that,
tapping,
James?
huh?
What's that called?
It's called the Beach Band, Beech. Carl Beach is an Australian who has figured out it's a wristwatch looking thing, and it thumps at a mother in the womb's heartbeat, about 80 beats per minute, and it just taps on your
Yeah,
wrist.
it's
And
it's
he's
like a
had,
metronome. Yeah, it
yeah,
helps
it's
you
like a
keep time.
metronome.
Yeah,
Now, I don't know, and there's also another friend of mine. So that's three things. There's our gloves, there's the Beach Band, and there's Nick Ortner, the tapping solution, where he taps on various meridian points on your body and repeats affirmations, which I thought was a lot of hooey years ago, but this is clearly something that relates to this. Then another friend of mine was talking about, and he sent me a link, but I haven't looked at it yet or studied it yet, but it's another tapping various points on your body to get relief. But Carl Beach, if you look that up, look at some of his podcasts. He turns the thing on when he's in approaching his off section of his meds. He specifically, in this one podcast I saw, he was at his meds were wearing off, and his speech is affected. So he had the beach band on with it off, and his voice was very affected. He hit the switch, and immediately his voice was back to normal. Now, I don't know if that's a scam or not. I don't think it is, but it's as dramatic as Kumar on the Today
Fantastic.
Show.
Yeah.
I mean, it's dramatic. So there's something to this vibrational therapy, tapping, and I now for me, I don't know as though these gloves are doing anything for me. I have a tremor in my right hand, and I'm in very early stages of Parkinson's. So, and I'm going to meet with a motion therapy, a movement disorder specialist on May 5th in Rochester, New York, when I finally get settled back there. So I'll get some answers as to what's going on with me. I'm new. I'm very new to this. I was only diagnosed in October of last year. So I don't know anything about this, but it's like a fire hose of information. Every night I look at something online, or I'm reading Ray Dorsey's. Right now I'm approaching the end of the Parkinson Plan. And I've already read Ending Parkinson's Disease, which is Ray Dorsey and Michael Oken and a bunch of other guys.
Right.
So
Right.
I'm new to this. So if I sound like a newbie, that's what I am. I'm trying to figure it out.
Yeah, so a couple of our folks have, shown me their beach band, and that's yeah. So I mean, maybe I could devote one of these coming Sundays to a more careful look at it. I mean, to my knowledge, it's not been tested, by neurologists or any kind of trial.
Right.
Again, the trial that Tass ran was just 6 days, but Tass did. He came upon this timing sequence for basically kind of 10 years of modeling and animals and computers to kind of find stimuli that would desynchronize circuits in the brain. And then lo and behold, this seems to have worked. So I need to look more carefully at Beach's claims, for how this kind of gentle tapping on the wrist. I've worn one myself because Patrick, one of our Santa Fe participants, kind of lent me his during a meeting we were having. So it's intriguing. So it's the tapping solution and meridians and acupuncture. I mean the fingertips are the gateways to the brain, in a very non-invasive but super indirect way. So the question is, how does it work? And for me, since the glove seems to be working for 10 or 20% of you guys out there, then can we tune it to meet your symptoms?
Exactly.
Or does it just have a tiny sweet spot that's only amenable to a reduced population? I need to understand that better. So,
well, doesn't the DBS need to be tuned in as well? You get the
a little bit louder. Sorry, say again.
Doesn't deep brain stimulation need to be sort of tuned as well to get the?
Yes, it does. Yeah. And so, I mean, depending upon kind of the phenotype, whether the Parkinson's is kind of tremor dominant or not tremor dominant, they even choose different nuclei with different ganglia within basal ganglia to stimulate. And then once they're there, then the doctor is literally like turning a knob in order to find kind of literally a sweet spot for not just where, but at what kind of frequency and amplitude to deliver the shock, for lack of a better word. And then so there's an electrode inside that allows them to measure, and the other electrode allows them to stimulate. And then over time, the Medtronic's device at least is adaptive in the sense that, as your symptoms progress or regress, that you should not be getting kind of a tonic jolt to the basal reset to the basal ganglia. And so the future technologies for DBS are definitely adaptive. So I don't see why we can't do that with the glove. And the DBS adaptivity has the advantage that they're measuring signals in real time in the place that's most damaged by Parkinson's. Where if we're doing adaptive glove work, then we're taking kind of indirect measurements, right? We're measuring your gait and your voice and your symptoms. Those are slower signals, than actually reading brain waves down in the damaged area. But again, I'm still hopeful. There are quite a few things, that are slow moving. I mean, your blood levels and insulin levels are fairly slow, and we use those, as biomarkers to decide on how much insulin to. Any other updates or questions or concerns about the gloves that you guys are wearing?
No, other than I've been given mine the torture test and I've had to repair them.
We got that. Yes. Yeah. I'm glad you're able
So
to do that.
treat them
Yes.
gently.
Yes. Yeah. That's. I'm frustrated with how fragile they are. They really need to. I think the electronics is in good shape. The code and the app are kind of maturing, but I still feel like they're too fragile.
Is there anyone else here today that is connected up with the app, the Android app?
Not me.
Oh,
Not yet.
James, could we be in touch, James? I'm starting to. I just got the pin from Steve so I could complete my installation and hopefully enter all my data.
So yeah, I've used it periodically. The only thing I do is the record the walking and the speech, and then I don't know so I guess the data is then uploaded to the GloveWorks server. I don't know what happens to it.
Yeah. It's upload to a Firebase database at Google that we have account set up.
Yeah, so I
Wow.
just turn it on periodically. I go for a walk, and then I record my voice periodically. It's maybe once a week. That's about all I do.
What's the name on the app?
Just Espanola GloveWorks. You can find it under. Well, I guess there's a couple of how-to videos, on the website, but then also it's on our GitHub page as a repository where we can post open source information. So there you download an APK. That's the extension of the file. That's what kind of Android phones need to read. And for installing the APK, there's a separate little video on our website, on our YouTube channel, the same place that I'm putting these videos from our Sunday discussions.
Is it available for iPhones yet?
It's not, but we
Not
are
yet.
definitely we're getting closer. I think we've got. I hate to say whether it's 1 week or 1 month, because the folks that are doing the work are doing kind of part time in addition to other work, but all the tools are in place. It's just a matter of kind of jumping through a few hurdles. We spent a little bit of extra time figuring out the best way to do that, because rather than having an Android group of coders and an iPhone group of coders, just in the past 5 years, platforms have developed their so-called cross-platform. You can write one app and then have it built out for an iPhone or built out for an Android. And so when we wrote our Android app, we were just doing it in a straight Android platform. So now we're kind of porting that to the more general thing. Then going forward, then we can just really, as we update, the function of the app, it can then get built out for the Android iPhone.
Steve, I'm having a hard time hearing you.
Gotcha. I wonder if I'm probably speaking to the wrong part of the microphone. Thanks for that. I'm in the car; it's a little bit noisy, so I had to. Is my voice better now? And talking to this microphone.
Yeah.
Okay, gotcha. All right. Thanks for flagging that. So I was perhaps going into the weeds as well as I hugged the phone to my ear about just the fact that it's been this whole project is a learning experience, and it's somewhat slowed, by my focus on bringing students along with me in the process, and so we will now have a platform where, as we make updates to the app, it will get pushed out to both the iPhone world and Android world without me having two coding teams, one for Android and one for iPhone. So these tools are there, and I'm super excited to learn these tools and share them with my students. It makes them also much more job ready.
James, would you mind if I emailed with you about some of these details about the app?
Sure.
What's
Just
your email?
I'll put it in my email in the chat.
Thank you.
Me too. Thanks.
Great. Any other updates or things we should be thinking about in the next few weeks?
I think we're good.
I was interested. I showed a friend with Parkinson's, talked with her about the gloves, and we looked together at, getting her involved. And it looks like there's a waiver now. I don't remember if I signed that or not, but in that you mentioned wearing them once for an hour or two. I would love
Yes.
to have the, tips or tricks. Should I be moving or not moving? I think I missed that part
Yeah,
of.
that's another key variable, right? Yeah, a waiver I hope has been there the whole time, right? I mean, and again, I just I understand. I want people to help experiment with this, but I also want people to understand, that we don't, that this is an experimental protocol. So the waiver is just there to let people try to be up front, with who we are and what we're offering. So I think that's been there since day one. And as far as so the recommendation from TOS, the small study at Stanford, was 2 hours twice a day. And the early feedback I got, say the first 60, 70 people, that 2 hours twice a day was a serious chunk of their life that was being kind of constrained by having these fingers locked down. And then people were giving me feedback saying that wearing it for 1 hour twice a day, they were still seeing some benefit. So that's the language then that you see kind of on the onboarding, 1 to 2 hours twice a day.
Mm-hmm.
Then as far as activity goes, that has not been kind of carefully measured. Some of our folks are wearing these things to bed. They're soothing, or they're getting 2 hours in the morning by actually sleeping with them after setting an alarm. Where other folks, this goes back to Conwar's initial kind of testimonial. Conwar, the kind of the poster child for Tos's glove, found his experience was that he got greater benefit when he was active while wearing the gloves.
Mm-hmm.
But again, these are kind of really one-offs, and anecdotal, and these are things that clinical studies need to kind of get to the bottom of. I hope the gloves are not so fragile that people can't, So I know driving is fairly comfortable. Hoping people can hold a pencil perhaps or a pen. People can hold a coffee cup and the like. It's a little bit difficult typing on a keyboard, I imagine, but thumbing a cell phone is possible. So yeah, I would love to put more particular information on the waiver, right, and an update about really what's recommended. But these are such early days where I don't really have strong recommendations. So I think that's another thing that can happen here, right, on these Sunday mornings that people can share, or they can share on the Facebook group on Instagram, about kind of what they found to be kind of the best balance, right? Balance in the sense of bang for the buck. How much relief do you get from certain hours of the day, and whether activity helps, hurts, or is just agnostic.
Right. Great. I'm sure I just didn't really pay attention to the waiver. Forgot that information at this time, but 1 hour is a lot less than 2 hours for some reason.
Yes.
Like an hour, that's nothing. By the way, someone's trying to sell me their beach band for $20. I saw an awful lot of inconsistent information. When I saw the presentation on The Secret Life of Parkinson's, he was saying that it was a temporary. This is kind of a.
Gotcha.
Anyway, I'm going to try it myself and see what I think.
Yeah, I mean, that temporary word is also, for me, one of the real I don't know, one of the exciting points of Toss's study was that these results, the benefits were cumulative, right? So even when someone was after wearing the glove for 3 months, and not wearing it for a month, they did not regress, right? The benefits sustained. And then once the glove went back on after a month off the glove, the scores just kept on going down. So that says to me, that these gloves are changing the brain,
Yes.
in a good way. So, yeah. So I really hope, again, I've been kind of locked away, with these folks this past week. I have not really been following the Facebook group, but I really hope that is a place where people can share just their lived experiences about whether 1 hour is sufficient or whether they saw a drop off in benefit by wearing the gloves, lesser periods. I know 4 hours, that adherence is a very, very challenging thing to keep for a lot of people.
Did you meet those young engineers from Rice?
Yeah, thanks, Ken. So I did not meet the engineers at Rice. Yeah, I mean, I reached out by 3 channels. I had been in contact with them, in the early days. And this was also spring break at Rice, so it's possible these engineering students were off. Yeah, maybe yes, spring break, going to Fort Lauderdale. Maybe they were in your town, Ken, rather than
They were in Florida.
Yes, yeah. So that was frustrating, right? So I was really, it was like right there back on campus, having whiplash. I taught at Rice for 30 years. It's then kind of I pressed reset in order to work with the different population of folks in northern New Mexico. So it's exciting to be back. But I did get a chance I met with lots of folks in the medical center. And as I mentioned, this electrophysiologist at the University of Houston, who has actually done some EEG work, kind of discerning finger vibrations. He's in it for the entirely different side. He's doing kind of rehabilitation and haptics for prostheses. So can you use fingertip vibrations to as kind of input devices to make things happen, in limbs that you don't have. But in any event, he's interested in mapping the circuits from fingertips to cortex, using kind of passive measurements like these electroencephalograms. I guess so. One other thing to record. I don't is Ken H here with us? Hi, Ken.
Don't see him.
I think he might have church duties on Sundays. So Ken was interviewed some time ago for an article about GloveWorks. He made a very generous donation that we're trying to acknowledge. We've also gotten kind of 2 grants since then. So a fairly long press release went out last week from my college, and that got picked up by FAQ News. They just published the whole thing. And I have an interview tomorrow morning with the Santa Fe New Mexican about kind of an update on progress report with the club. So it's just kind of just an update on kind of publicity, getting the word out there. GloveWorks will also be tabling at the Santa Fe Moving Day, the Parkinson's Moving Day on May 2nd. So that'll be another chance for us to kind of support the Parkinson's community there and get the word out about the club, and maybe do a little bit of triage and updates and kind of app demonstrations and the like. So May 2nd is that moving day in Santa Fe. And I'm not sure if is that a nationwide effort? Is that a
yes,
time
it
for,
is.
Yeah, is that right? Okay, cool. And so I do have kind of a trifold pamphlet also on the webpage. So if people would like to print out that kind of trifold pamphlet, kind of advertising what GloveWorks is up to, if you guys wanted to share this at your moving day, hallelujah. If you have trouble printing them, you can just request them from me, and I can send you a bundle. So with that, I might want to move on. I have to be looking at the screen, so hopefully you can hear me talking. So, let me see if I could get around to find my screen share button on the phone. It's coming. Okay. Yeah, so it's, I guess, yeah, we can even, I believe I'm beginning to share the first of two papers with you guys. Can you guys see a picture of the cross section of the brain on your screen?
Yeah.
Yep.
Great, great. And can you hear my voice at the same time?
Yes.
Yep.
Okay, gotcha. Uh, yeah, so this is a pair of papers, and again, they're brief because they're in Nature, and Nature is the premier. There's not even a second place close to it. Nature is the premier science publication in the world. It's the most highly selective, the most sought after, the most prized, the hardest thing to publish in. So to publish kind of two very lengthy articles in the last 2 years is a is a feat. So that's just one indication of the importance of the work. Um, and and this picture largely summarizes, in kind of graphical format, uh, what maybe initially looks like a minor kind of reorganization of the brain, but it's turned out to have like major implications, even giving us new targets in cortex for how treatments may best affect Parkinson's. And so what you see on the left is the old map of motor cortex. And so, you see a very enlarged hand, right? And then I'm there on the left side of the picture, kind of the black and white. You see hand, and then little ring, middle, index, thumb, neck, and brow before going into the face. And so that's a map that was first built about 100 years ago, by literally putting electrodes into cortex and then watching which muscles started to move in the human body or other primates, right? So primates have a pretty similar cortex to ours. And so, and, but of course, there were parts of motor cortex, where there'd be stimulus and like nothing would happen. Um, so those were kind of dead zones, or maybe just bad recordings, or experimental error. Uh, but that admission of ignorance kind of got glossed over time. In this cartoon, of the so-called homunculus, how is the human body mapped onto cortex? This map just became gospel in some sense, right? It really gave like a beautiful kind of a very easy visual for how the body is laid out. And because these are difficult experiments, right? Not many people want to volunteer to have their brain shocked and then watch which muscle twitches. And so it's only been with the advent of kind of new imaging tools and new signal processing tools that we've been able to move from the map on the left to the map on the right. And I really, really want to concentrate on the blue zone, right? So the blue zone on the right is this as I magnify it here, does that magnify it on your screen, you guys?
Yes.
Okay, good, good, good. Again, I'm on my phone. I apologize for my, kind of the amateur presentation, but we're now zoomed in on the hand. And instead of having the hand kind of mapped out, say, top to bottom, what we see is that the greatest concentration of mechanoreceptors in the skin are on the fingers, and the fingers are in the center of this field, right? Do you guys see fingers in the center of that field?
Yes.
Yeah, and then as we move away from the center of the field, then you've got fewer and fewer neurons that are loyal to just the hand. and then the wrist, and then the elbow and the shoulder, right? And I it's the cartoons again. They're just too damn suggestive. But I think most of us agree, right, I mean, my shoulder is way less sensitive than my fingertips,
Yeah.
and the idea that there's really like a target here in cortex, where the bullseye of the target, the place that is kind of has the highest density of skin receptors to pressure, vibration, that's sitting there right on our fingertips. And so that kind of, fingertips, hand, elbow, shoulder is a very big piece of real estate in cortex. Now, as we move left, there is a very strange puppet being hung by 5 strings. We'll get back to that soon. But let's move across the puppet to the green zone, right? So the green zone that's the amount of kind of real estate dedicated to hips through toes. And again, the toes being the most sensitive objects in that whole chunk of our body, right? They're represented kind of in the center of the bullseye of that field. So we see relatively, assuming kind of equal thickness of cortex, that there's a lot more real estate, as we already believe, dedicated to the hand than to the feet. Now I want to move back to the puppet. It's kind of in between. So if you do have the curiosity to read through the text of the paper, you're going to see that they've now divided motor cortex into so-called effector regions. So by effector, what it really means is that, let's still maybe stay in the blue zone, right? That if we stimulate a finger, if we stimulate a cell in this part of the cortex, the finger feels it, right? So this is motor cortex, right? This is how the brain makes you move. It's parallel and adjacent to sensory cortex. We don't yet have a detailed map like this of sensory cortex, but motor cortex, is I think for Parkinson's, it's kind of ground zero, right? Because for the Parkinsonian patient, to the best of our knowledge, your muscles and ligaments and tendons are in fine shape. What's getting messed up are directions from motor cortex. Now, of course, we're going to see those directions are modified by the basal ganglia, right? But if we don't have a good map of motor cortex, then there's no reason we should have a good understanding of Parkinson's. So this remapping of motor cortex is literally a reorganization of research on Parkinson's. And so let's get back to this kind of the purple region, the action body. So it's got the whole puppet, it's got the whole body. And so these are cells that do not make individual muscles fire. Unlike the blue cells and the green cells, they do not make individual muscles fire. They instead talk to each other. These puppet zones and motor cortex talk to each other, and then they also talk to other motor neurons up there, right? So they're not going directly down to muscle, but they are talking to each other and to other motor neurons in the cortex. Now, most importantly, these kind of whole body, action body pieces, these nodes in the motor cortex, they talk to each other, they talk to motor neurons, but most importantly, they talk to the basal ganglia. That's the place that is damaged by Parkinson's. That's the place where muscle patterns need to be organized or disorganized. That's the place where voluntary movement is actually allowed or disallowed. And so not only did they find that there are these nodes, these kind of action body kind of islands, right, within motor cortex. So 3 of them kind of separating the mouth from the hand, from the foot, the most sensitive places on our body. So not only are they there, but in the next picture I want to show you, they are the ones that are predominantly connected to the circuit that's attacked by Parkinson's. And that's the real kind of take-home message that I kind of wanted to get across. And that's in the second paper, right? So the first paper was just identifying that our previous cartoon of kind of the motor cortex, that previous cartoon, I mean, everyone knew that it was a cartoon, but it was one of these, such a great condensation of complicated knowledge that it was just a natural thing to teach med students, and then these med students teach it to other med students, and it becomes so it's taken really new tools, not just new tools. And if you look at the author list on these papers, it's got 30, 40, 50 authors, right? So these are like a Herculean collaborations across labs all over the world, developing these kind of new imaging tools and new analysis tools. And then in the paper that I'm about to take you to, then new therapy tools. So
Your voice is breaking up a little bit.
So it's
Your voice is breaking up a little bit.
Yeah, am I breaking up?
You were.
Can you guys hear me now? My driver says we are in the middle of everywhere or the middle of nowhere. That's clear. Fields right to the left, on our way into New Mexico. Can you guys? Yeah. Am I there? You guys? I can't hear you. It's free.
Yeah. You send a message. Might not get there.
Am I back? Can you guys hear me?
There you are.
I
Yes.
think it's
Yeah.
better.
Yeah. Is that better?
Yes.
We were
Yes.
might have been some kind of depression. So yeah, I think I've got 11:44. So let me try to show you guys one more picture, the one that's really leading to results for Parkinson's. But before I go there, are there any questions on the figure I just showed you? Hopefully you guys have access to that picture. It's such a valuable insight to kind of have a fine map of another part of the brain.
You're breaking up again.
Steve, is there a link to this article on the website?
Yeah. Both these articles are linked in the current agenda, and that agenda I sent you by email. That agenda is
Right.
also there on the journal page on the webpage. Yes. So
Thank
both
you.
are there, and I will continue talking about these things. Still, this might be a smart time to really, rather than kind of going back and forth. If I got you for a couple of seconds, maybe I should just kind of close down the meeting so as not to waste your time. We really are.
Steve?
Trying to get back to page. No. I think I might stop the share, and then just because I'm kind of if I'm breaking up, I think it might just be best to hold off until 2 weeks from now. I'm also going to be in a challenging place 2 weeks from now. I'm visiting my mom in Chicago over Easter. She's yet to have the interweb. It's also Easter Sunday, so maybe that's also not a convenient time. So stay tuned for kind of an announcement about where our next Zoom meeting is going to happen.